Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about Raynaud's disease. About 5% of the population in the United States have this condition. Raynaud's is a rare disorder that affects the arteries. Others are the blood vessels that can carry blood from your heart to different parts of your body. Raynaud's sometimes is called disease, syndrome, or phenomena. This disorder marked by brief episodes of vasospasms, which is the narrowing of the blood vessels. Vasospasms of the arteries reduces blood flow to the fingers and toes. In people who have Raynaud's disease, usually affects the fingers. In about 40% of people who have Raynaud's, it affects the toes. Rarely, the disorder affects the nose, the ears, nipples, and lips. Often, the cause of Raynaud is not known. This type of Raynaud's is called Raynaud's disease or primary Raynaud's. Raynaud's phenomena sometimes a disease, conditions, or other factors causes Raynaud's. This type of Raynaud's is called Raynaud's phenomenon. Primary Raynaud is more common and tends to be less severe than secondary Raynaud's. Scleroderma and lupus are two examples of conditions that can cause Raynaud's disease. About 9 out of 10 people who have scleroderma have Raynaud's disease. Other examples and diseases that cause the conditions include the following: rheumatoid arthritis, atherosclerosis, blood disorders, shortened syndromes, dermatomyositis, Buerger's disease, thyroid, and pulmonary hypertension. Repetitive actions that damage the arteries or nerves that control the arteries in the hands and feet may lead to Raynaud. Typing, playing piano, or other similar movements repeatedly over long periods may lead to secondary Raynaud's. Using vibrating tools like jackhammers and drills may also raise your risk of developing Raynaud's. Exposure to certain workplace chemical can cause scleroderma-like illness that link to Raynaud's. An example of this chemical is vinyl chloride, which is used in plastic industry. The nicotine in the cigarettes can also raise your risk of developing Raynaud's. Certain medicines can cause secondary Raynaud, including migraine, headache medicines that contain ergotamine, the substance that causes the arteries to narrow. Certain cancer medicines such as displatin and vinblastine. Some over-the-counter cold and allergy medicines and diet aids. Some of these medications can narrow your arteries. Beta blockers. These medicines lower your heart rate and lower the blood pressure. Birth control pills, as these medicines can affect the blood flow. If you have a primary or secondary Raynaud's, cold temperatures or stress can trigger Raynaud's attack. During an attack, little or no blood goes to the affected body part. As a result, the skin may turn white and blue for a short time. As blood flow returns, the affected areas may turn red and throb, tingle, burn, or feel numb. Raynaud's attack lasts less than a minute or a smaller several hours. This shows arteries in the fingers, digital arteries with a normal blood flow. This one shows across a sections of a digital artery. Figure B shows the fingertips that have turned white due to the blood flow. Figure C shows narrow digital arteries causing black blood flow and blue fingers. The image shows across sections of a narrow digital artery. Most people who have Raynaud's have no long-term tissue damage or disability. However, people who have severe Raynaud's can develop skin sores or even gangrene from prolonged or repeated attacks of Raynaud's. Gangrene refers to the death or decay of a body tissue. Let's talk about the cold stimulation test. A cold stimulation test can be used to trigger Raynaud's symptoms. For this task, a small device that measures temperature is taped to your fingers. Your hands are then exposed to the cold. They're usually briefly put into ice water to do this. Your hands are then removed from the cold and the device measures how quickly your fingers return to their normal temperatures. If you have Raynaud's, it may take more than 20 minutes for your fingers to return to their normal temperature. Nail fold capillaroscopy. You may have this test. For this, your doctor put a drop of oil in the base of your fingernail. He or she then looks at your fingernails under a microscope. If your doctor sees abnormal arteries, it may mean you have a disease linked to Raynaud's such as scleroderma. Your doctor may order other tests to look at conditions that are linked to secondary Raynaud's. Examples include anti-nuclear antibody like an erythrocyte sedimentation rate or ESR, or commonly termed the SED rate, and C-reactive protein CRP test. Treatment for Raynaud's includes lifetime style changes, medicines, and rarely surgery. Examples of medicines used to treat Raynaud's include certain calcium channel blockers, alpha blockers prescriptions, skin creams, and ACE inhibitors, which are used less often. Follow-up is very important for a more definitive diagnosis and to do tests for possible underlying cause of Raynaud's. You must follow up with your primary care physicians. You must come back to the emergency department for persistent symptoms of Raynaud's that can't go away in a few minutes or less than hours. Skin changes or tissue injury, or any systemic symptoms or worsened symptoms than the ones you had in your previous visit.